originally started out as the Klein School of Optics back in the 1800s, grew into the Massachusetts School of Optometry, became chartered as the Massachusetts College of Optometry, was at Newbury Street back in those days, and then when the college moved to the Beacon Street headquarters, became the New England College of Optometry. The mission of the college has changed over time. It's evolved with the changes in eye care. The unique thing about the New England Eye Institute is that it isn't a single institute. It's an amalgamation of a number of patient care facilities and practices that have unique opportunities for our students. The opportunities that students have when they go through here gives them the complete perspective of how optometry is practiced.
New England Eye is a clinical subsidiary of New England College of Optometry. We see about 85,000 patient visits a year, and these visits occur in a variety of different settings. We have 2 owned and operated clinics, one at New England Eye Commonwealth and one in New England Eye Roslindale. We also see patients in 14 community health centers.
What would happen if we brought healthcare to the community that we were actually serving? And that has happened, and it has flourished, and it's now the model for all the other community health centers. We provide full health care and holistic health care and all of their eye care needs, and we'll take care of that. And because we are small, I think that there's an added benefit to that, is that we have, in the eye department, we have a really symbiotic and really strong relationship with the primary care medical practices, with pediatrics, with all the other departments here.
I became frustrated by the numbers of children who, even though on behavior and on referral from a screening, they weren't able to get to care. That led to a collaboration between the Framingham Public Schools and the New England College of Optometry, New England Eye Institute, and the opening of the School-Based Vision Center 4 years ago in Framingham. It's eliminating many of the obstacles and barriers that have been documented for decades about how do children get to the eye doctor. And so by taking those steps and making those investments and creating those educational opportunities for the young optometrists, we're providing care to the children who need care, who are able to then get to care, the education that's provided not only to optometry but to educators.
What I really like about NECO and why I chose to come here was the unique clinical experience starting in your first year. They send you out on screenings with children, and you get to put your knowledge in the classroom to work in the clinic right away in your first year instead of waiting till your second or third year like most schools do.
We don't want to teach our students just to be optometrists. We want to teach them to be healthcare providers. We want to provide opportunities that are diverse. We want them to experience the community, and we want to expose them to different disciplines.
The cutting school was started in 1893 by some orthopedic surgeons who had patients who were not going to school because they couldn't get into the building. The children here have medical problems, handicapping conditions, learning problems, or communication problems. It's vastly easier for them to have the vision piece done at school. It's an appointment they don't have to take their children to outside of school. They've also told me about seeing people who are just not sensitive to the special needs of children in a wheelchair. Didn't really know how to examine somebody that they couldn't put in an exam chair and do their usual routine.
We're training the next generation of optometrists, our students, to think outside the box. Not only to see problems, but think about how they can be involved.
Not only are they learning about delivering primary and specialty eye care, but they have an opportunity to practice in a public health setting where they're involved in the care of the entire patient. Our care is provided to pediatrics, adults, and seniors. And we have a particular focus on economically, physically, and socially disadvantaged populations.
And when we talk about elderly, elderly are in a variety of different clinics, but when we talk about the care that we're providing for elderly, we're going to nursing homes, adult daycares, we're working with housing authorities to really go to them. We also do home visits, and the reason we want to go to them is because we'll be able to see things that we don't see on a daily basis.
The fact that we offer early clinical education makes us unique among all the optometry schools. Our students begin seeing patients in the second or third week that they're here. And Boston offers a lot to the medical community. Boston is the epicenter for high-quality referral healthcare, And that proximity for us offers the opportunity for our students to get exposure to things they wouldn't get in other venues.
So I came in here for her to check out my eyes and see what's going on with my eyes because I'm also a diabetic. And she saw that I had some spots in my eyes. She sent me to another doctor to see if what they saw, and they said it was diabetes. Dr. Yoshiyama said no, it wasn't.
She's a young woman. She should be out there. She should be active, and she should be doing these things. And the story she was telling me was that she had sort of closed down, and she wasn't able to do the things that she wanted to.
And now anything she tells me to do, I just do it because I trust her.
It just really embodies like everything that we want to do here. You know, the teaching of students and the caring of patients, and just sort of the fact that we're all friends here as well.
Raise me up to more